I'm Carol Celine, talking with pulmonologist Dr. Sal Mangione. As a general pulmonologist, what are the conditions that you treat?
Well, mostly obstructive lung diseases like emphysema and asthma, some tuberculosis, cancer of the lungs.
But asthma, which I
Yes.
think you're very interested in, seems to be on the increase today. Why is that?
Well, it's getting more common and it's getting worse. People don't really know exactly why. There are many explanations. The urbanization, changes in the social environment. It's become almost like a social disease, and it's killing. Used to be a disease that you die with but didn't die from. Now you die from.
Really? Well, why? And it's so much worse, and yet we have, and we'll talk about that in a minute, all these new medications. What are the symptoms of asthma? How would someone know that they should see their doctor?
For little children, first of all, it can be acquired any stage of life. And that definitely is not a disease of young individuals or kids. In young kids is recurrent bronchitis, which actually happens to be asthma. And typically it's the child that wakes up at night, can't breathe, is coughing, gets wheezy when he runs, gets very short of breath. That's the kind of kid that should be brought to attention.
That cough too, that asthma cough is like a bark, isn't it?
Yeah, it's a persistent dry cough, keeps them up at night, and it's called a lingering cold, and it's not.
So if your kid has that more than a couple times a year, you want to be checked out for asthma.
Correct.
Are we treating asthma today any differently from the way we used to?
Yes, we actually have excellent inhaled medications. In the olden days, they were not available, which are really anti-inflammatory, so they really can control it.
And I think you told me, though, that many people who have asthma also are not really suffering from asthma, but some kind of a vocal cord problem.
Many times what seems like asthma, it's actually not. It's a closing of the voice box done involuntarily by the patient, and is often misdiagnosed. They say as many as 1 out of 3 severe asthmatics that go to a tertiary care center have actually that condition, vocal cord dysfunction.
And is that treatable?
Yes, it's again some sort of a conversion reaction. It's their psyche manifesting itself by closing the voice box. So the treatment is not asthma treatment, is more psychological.
Oh, how interesting. Wow. And another disease I know you treat is TB, which is on the rise again. I mean, we used to get those little tests in school when we were kids, and I thought nobody had TB anymore. What's caused this change?
Well, the change has been the development of resistant organisms, and that has really made TB more and more of a concern. And in addition, there is also a strain of TB that is kind of a cousin of TB called MAC, which can affect damaged lungs, not necessarily good lungs like TB, and it's very difficult to get rid of.
But what advice do you give people in terms of taking care of their lungs?
Well, it's the same advice that Yul Brynner gave when he got his lung cancer: don't smoke. And if you have lung disease, definitely don't smoke. And if you don't want to get lung disease, don't smoke.
It's that simple. Don't smoke. Throw away the cigarettes. I'm glad I'm not a smoker. Thanks for coming in.
Thank you.